you ever reflected on the seriousness of concussions? Concussions are far worse than we perceive. Whether you like it or not, you're at risk of receiving a concussion every time you're on the field. It can affect you later in life and can cause major brain damage. Concussions have been known to disrupt brain function. According to the Journal of Clinical and Experimental Neuropsychology, college-aged athletes who have suffered a concussion see their working memory capacity, or WMC, decrease with increasing workloads. So essentially, as the brain processes more information...
Mrs. Stokes, if you are available, you have a phone call on line 1. Mrs. Stokes,
I'm keeping
you have a phone call on line 1 if you are available. Thank you.
The WMC decreases with increasing workloads. It has been shown by another study produced by the Journal of Clinical and Experimental Neuropsychology that athletes participating in high head contact sports are more likely to show diminished WMC. Possibly the most alarming facet of concussions is the risk of CTE. Chronic traumatic encephalopathy is a neurodegenerative disease that can appear in a victim who has suffered too many cranial injuries. Most posthumous examinations have been made on deceased. Many posthumous examinations have been made on deceased former NFL players. CTE has made recent news due to its gradual degradation of brain nerves, resulting in a loss of certain brain functions. Players have lost their lives playing with CTE. In fact, 17-year-old Nathan Stiles, who suffered from CTE, died shortly after playing a football game in which he received a massive concussion. Stiles had a history of concussions, the last of which effectively ended his life. There have been multiple accounts of NFL players committing suicide whose families learned from after the autopsy that their loved one had suffered from CTE. Junior Seau was one of the most notable of these players. Seau was one of the most feared and intimidating linebackers in all of football who unfortunately decided to end his life because of ongoing brain function issues. The fact is that concussions are killers. Recent suits have been filed against both the NFL and NHL by former players claiming that they wouldn't have played if they would have known the injury risk of concussions. In the case of the NFL, players have retired from the game earlier in their mid-20s due to fear of concussions. One of the most difficult aspects of concussions is how to detect a concussion. Although athletes may not even realize they've received a concussion, which is what makes them so deadly. Many schools have guidelines about concussion protocol, and most state activities association organizations have made baseline tests mandatory before the sports season begins. The players then take the same test at the end of the season, and supposedly the results will infer whether or not the athlete has a concussion. In reality, it's nearly impossible to detect a minute concussion. Symptoms of concussions can vary. One victim of concussion might experience dizziness, slurred speech, and nausea. Another, vomiting, inability to pay attention, and memory issues. Contrary to popular belief, one may not experience symptoms immediately after receiving a concussion. One might show signs of concussion days or even weeks after the original incident. Some concussions manifestations may have lingering effects that hamper the victim for the rest of their life. Nearly any other malady can be treated by just looking at the concussion. Concussions are an exception. A concussion sufferer may not even know that he or she has a concussion, which is tough to stomach, especially for parents knowing that their child could suffer serious brain trauma later in life. So the next time you play a pickup game of basketball or maybe a football scrimmage, remember what you are at risk of receiving.